Welcome to Bern, a city full of tradition and culture, but also at the forefront of innovation.
So the master's program AI in Medicine is a one-of-a-kind program that allows students who already have a bachelor's in engineering sciences, math, physics, to explore and learn about how AI technology integrates into clinical applications, and to couple that with the exposure of what it means to work today in medical-oriented disciplines.
For me, I wanted to continue my background, that is as a biomedical engineer, and I thought this program is a good fit and a good intersection between healthcare and computer science. And these masters allow me the flexibility of continuing my work, so it was a perfect fit for me.
One of the best things of the AI in Medicine Masters for me was the ability to manage it alongside part-time work. Courses are only on 3 days of the week, which means that I can manage my work hours perfectly around the Masters program.
It's a 2-year program where you get to cover topics from machine learning, computer vision, natural language processing, but also what are different clinical applications, how do different departments operate in hospital settings, where is AI and its derivatives relevant for medicine today and for tomorrow. And so together, by coupling these two aspects of medicine and technology, the program provides a pretty broad view of what it means to do AI in medicine today.
I also learned a lot from the clinical visits to the hospital, because I think it's very important from someone that is going to work closely on a healthcare system to understand clinicians and their needs from the beginning. And I think it was a very productive moment to see this as a student and not as a person that is working, and to understand really what they want and how they communicate, and that is also that I use every day.
There are two things that make this program very unique. The first is that it is fully embedded in a medical faculty attached to a university hospital that is broad, covering departments from dermatology all the way to cardiology. And in that sense, the program is embedded in a very, very clinical environment. That makes it special.
During the clinical visits, I was able to learn how every department of the hospital works. They show us all the workflow, what they do as early in the morning, what's the process of everything. And that was very helpful for me to understand what are their needs and how can I also improve some workflows or maybe propose some solutions with the help of artificial intelligence.
The other aspect of this program, which is unique, is the fact that we're not just focusing on a specific type of modality, for instance, imaging. The program covers many different aspects of medicine, but also many different aspects of technology relevant in medicine. The goal of this program is that when you finish it after 2 years, you are both fully versed on the technology side, from programming, concepts, methodology point of view, everything related to AI, and at the same time have an understanding of what it means to be in a clinical environment. What are the questions one needs to ask in order to develop the right technology for the right user? What are the kinds of risks that are involved? What should we be aware of from the clinical endpoints that are relevant to see if the technology that is envisioned is relevant for that specific unmet clinical need? And so the program really builds on being able to bridge the clinical need with the technology side in order to get there. In practice, that opens the gateway for interesting job opportunities in the medtech and data science industry, but also opens up, of course, the possibilities to continue education with PhD programs anywhere in the world.
So currently I'm a PhD student at the University of Bern, and I work with topics related with artificial intelligence in ophthalmology, so more concretely on progressive eye diseases, and I use machine learning for it and to build more patient-centered solutions for them. If I look back to it, I would say that it was quite intense, but very rewarding, so I'm really glad I did it.
When we thought about building this program, we really thought about it in a selfish way. What was the program we would have wanted to have when we were studying at this stage? And in this sense, coming into the Masters of AI in Medicine is really a reflection of what we believe today to be a fantastic opportunity to work in two separate and parallel environments and bringing them together.
Don't forget to apply now for a start in September.